Today we're going to talk about phantom limb pain. So, what is it? Amputees sometimes report feeling pain, burning, tingling, or other sensations in their removed body parts. People who have experienced it describe it as if they can feel the ghost of their missing limb. The sensory nerves are obviously no longer there, no longer connected, so what is causing these perceptions? We're not entirely sure. Even now, providers that treat patients with these symptoms are unable to give factually based reasoning as to why this feeling happens. They can only treat the pain. One simplified explanation that's popular is that the peripheral nerves, that is, the nerves in the outermost area of your body, are miscommunicating with your spinal cord and brain due to the physical trauma of the amputation. The neurons are firing at random, communicating sensory experiences like pain that isn't really happening. It's a good guess, but more recent research has a better one. Meet homunculus. That's the name for the strange-looking spread-out guy on the right side of your screen. His disturbing proportions match the proportions of something called the cortical body map in your brain, which is a mental map of the entire body used in the brain to communicate impulses from neurons. This map spans a cross-section of your brain and exists largely in the parietal and frontal lobes. As you can see, different body parts are divided between the halves of your brain, and different body parts are seemingly unorganized next to each other. You can see that the head is really close to the hand. Things are just a bit jumbled. In some other experiments, researchers used stimulation of the lips to try to promote phantom limb pain in an amputated hand because they are so close together. So, when a limb is amputated, say the left arm still exists in this cognitive map. The area of the map that represents the left arm does not shrivel up after the arm is removed. One study in monkeys found that the neurons in the cortical map increased responding to neighboring cortical areas following amputation, which is why that one study was conducted by stimulating the lips to stimulate phantom pain of the arm. So, for example, if the arm was amputated, the cortical map might respond to the arm after another body part, the lips, that is represented next to the arm, experiences stimulation. Generally, there is a belief that following injury, the brain reorganizes itself and repurposes the areas of the map that are no longer connected to the amputated body part. That concept is part of an ongoing debate with significant evidence both for and against it. Researchers studied the electrical impulses within the cortical maps of 3 adult participants before and after a scheduled amputation surgery. Participants were asked to perform intricate movements of the hand and arm and to imagine the movements of their hand and arm to stimulate brain activity. They found that the responses were surprisingly consistent up to 6 months following the amputation. Little had changed in the function of the cortical map, which provided some evidence against the theory that the brain immediately reallocates unused space to different functions. This supports the idea that the spaces in the cortical map are kept intact after injury. But before we take that finding as fact, let's look at some of the drawbacks of this study. First, the sample size is extremely small. Nearly any result can occur from a sample size of 3. Obviously, it's difficult to find a way to measure this using more participants because they need to agree to a study and also have plans for an upcoming amputation. Second, the results were only measured up to 6 months following the amputation. Even though the brain map representations were largely stable and unchanged, some depreciation of the area had occurred, which suggests that over time, more changes in the brain may be happening. This is also something that can be difficult to measure. It's not easy to find participants that are willing to contribute more than a few weeks of their time, let alone months or years. Overall, phantom limb pain is a super interesting topic that's largely still under investigation. The more we learn about it, the more we learn about how interconnected the mind and body really are. If you'd like to learn more, this is my source. Thank you.